everyone, and welcome to our debate today. Today I'm joined by our health and social care team here at UCEN Manchester, and we're going to be talking about what is to be done to address health inequalities in England. So Adam's here. He's going to introduce himself first and then pass around the room for who we're joined by today. So Adam, over to you.
Okay, thank you, Isabel. My name's Adam Sleeman. I'm a department team lead for the care professions, which includes health and social care and childhood and youth studies programmes for UCEN Manchester. And we thought one of the burning issues, the burning topics for discussion at the moment within health and social care is the hot potato of health inequalities. So we will be watching a short film which is all about of the Marmot report, and we'll be analysing and discussing some of the findings from that, which is all around the subject of health inequalities. I'll now pass you over to my esteemed colleague, Dr. Elvis Amokwe, and allow him the opportunity to introduce himself.
Right, thank you, Adam. I'm Elvis. I'm the course lead for the health and social care, and my background is actually in the primary care research. So a bit of health inequalities is part of the work I do. So hopefully I'll be able to contribute and then answer a few questions. Thank you.
We pass over to Rebecca. Are you okay to introduce yourself and your role here as well?
Sorry, I'm used to myself. I was talking to myself as usual.
It's a very familiar feel at the moment, isn't it?
Yes, I know it's like. Hi, my name's Maria Hermit, and I'm the tutor for UCEN Manchester. My interest is in sociological and psychological perspectives in ill health. That's my little short and sweet thing. There we go.
Okay, I'm Rebecca. I'm one of the course leaders on the foundation degree, predominantly the level 4s in childhood and youth studies. So hopefully I can contribute as much as the health and social care staff as well on this one.
Fab. So Adam, do you want me to share that video as a starting point?
Yes, I think that would be a great idea. Yeah.
If we go from there. Just gonna double check it's all loaded and all fine. Always a nice little challenge, teeing all these different bits up.
There's no sound at the moment, Isabel. I know how we do it normally when you switch on the share computer. Oh, that's it.
It's great to see you here. I said when we began this journey that we wanted to create a social movement, and I think the representatives of that social movement are sitting right here in this room. Thank you. As I've said, the health of a society tells us a great deal about how well that society is doing. If health is not flourishing, the society is not flourishing. And there are big inequalities. You can see that the less deprived, the longer the life expectancy. For the least deprived 10%, I've got women here, least deprived 10%, there are regional differences, but they're relatively small. for the most deprived 10%, the regional differences are much bigger. We've got used to the fact that life expectancy and health improves year on year. That's what we've come to expect, and it's not happening anymore. This is a health crisis.
We don't know quite what is the other factors underpinning this change that we see. But we think that quite a lot of it is to do with austerity. Some of it may be about other more structural reasons to the economy, what's happened to industry, for example, in some deprived areas. And there could be very complicated cultural and social reasons why health expectancy is stalling. But something is very profound that is going on, and it's something that we have to get to the bottom of as a nation if we want to flourish in the future, because without health, we won't be a flourishing society.
Yes. Life expectancy has reduced in some of our poorest communities, particularly women in parts of the north of England. So you have to face up to the full reality if you're going to make things better. We should have a situation where health is always improving, and that clearly has stalled now. And this review has told us that, and told us some of the reasons why that is happening. And it's now about correcting those things and hopefully improving life for everybody.
It's all there. We can create a new consensus here if the government is in the room and if they are facing up to what life is really like in the north of England for the people they keep talking about. Well, actually, this is their lives on this screen. And where are they? They're not in here to listen about it. They should be in here to listen about it. People have had a hard decade, So on behalf of you all, I would just like to say thank you to Michael and his team, then and now, for being a voice of sanity, authority, humanity, consistency. I wish I lived in a country where we listened to voices like that. I live in hope that one day we might do. Thanks very much for listening.
We have an epidemic on our hands. It's called knife crime. People are dying every single day. I'm just a grown-up mold of those young people. Half the things I've gone through, the trials and tribulations, I've been shot twice, I've been stabbed 4 times. Many of my young people who I mentor go through the same things. However, I'd managed to get A-levels and GCSEs while in prison. I was the first person in the country to get A-levels while in prison. They do not offer GCSEs and A-levels in prisons anymore. What are we doing to our young people? They do not offer mental health provision in prisons anymore. What are we doing to our young people? It's absurd that we have an epidemic like we do on our hands, but nobody's funding anything.
I think this is a devastating and shocking report, but such an important report. And I think, as one of the speakers have said today, we are facing a health emergency, and I hope this report provokes urgent action from government.
The thing we took for granted, which is a growing economy, reduces absolute poverty, has not been happening. And in fact, last year it actually managed to tick up, which is really quite impressive. Like, developed economies don't do that in general outside of big recessions.
The biggest thing that could be done is for lots of people over different organisations and communities to come together and say this is not acceptable, it can and must change. The biggest thing that would make a difference would be to have the will to want to change it.
We've said that the Prime Minister should make a priority for the national government reduction of health inequalities, and to that end he should chair a cross-ministerial committee galvanising action across the whole of government to take the steps necessary to reduce avoidable health inequalities.
Elvis, am I okay to pass to you? Looks like Adam's just a touch busy. Do you want to comment on that in the first instance about what that kind of clip's about, the Marmot review, what's happening there? Elvis?
Say it again. Can you repeat it?
Yeah, do you mind just talking us through? Adam looks like a touch busy right now, so are you okay to talk a little bit about the Marmot review and what's been talked about in that video we just watched there?
Right. If you look at England specifically, you could see that there's wild disparities in terms of health inequality. You can classify it in terms of gender, ethnicity, income. Because if you look at south of England, London area, compare it to the Midlands, and then look at north of England, especially northeast, you could see that health inequality actually impact on diseases. And my specific area is COPD. COPD is quite prevalent in areas where there is deprivation. If you look at somewhere like Yorkshire and Humber, Hull in particular, with the breakdown of the docks and the jobs going away, people having nothing to do, and then depending on benefits and this austerity coming in to make things worse, people started drinking, smoking. So if you want to look at COPD, it's more prevalent in deprived areas, and I can cite Hull area, Hull and Humber area as a typical example. So, but then apart from such regional disparities, if you go within counties, if you come to Manchester, for instance, you could have that some areas are more deprived than the other. And the more deprived the area is, the more life expectancy goes down. So this is a serious issue that needs to be tackled. And as health and social care, one of the main modules that we teach on is health inequality. We try to look at how health inequality actually impact on health. So this is an area that the report or what we just watched has actually highlighted. I don't know if you have anything to contribute to that.
Yeah,
that's what I can say.
I might come across to maybe Stephanie or Rebecca, just from because obviously you guys are looking at a bit of a different lens to this, aren't you? So I don't know if either of you would be happy to talk a bit about what this means from your perspective of things as well.
Yeah, it was interesting actually to listen on that video, and it's evident really that the North has a much higher concentration of deprived neighbourhoods than the South. And I think really for us, especially within education, it's important to try and engage within communities as well to support offers and efforts to reduce these health inequalities that do exist. So for myself, I think ways that we could possibly do that as using our platform within education, for example, engaging with communities, offering services and support guidance in relation to accessing education and making that accessible for all people as well, reaching out to settings, sharing employment opportunities as well for people within these deprived areas. If we can work with the communities and get more people within education and within employment, surely these inequalities can, they won't completely be reduced, but we can aim to support that.
I'll just add on from what Rebecca said there. That's a really good point. I think it's really important, like you said, to strip it back and just see what actually are because I think that the professionals are fantastic and they're all well and good, you know, and issues can be identified from an eagle eye perspective. However, I think we need to strip it back and actually see, you know, what is going on underneath the surface. What are the real issues that are causing these health inequalities? Obviously, bar the obvious, but that young gentleman spoke there about, you know, the epidemic in knife crime. Well, how does the epidemic in knife crime relate to, you know, health inequalities? Well, I suppose then he went on to talk about getting his GCSEs and his A-levels in prison. Is that another aspect? Is it education that we need to focus on here in order to eradicate these or reduce these health inequalities? Or, you know, what actually is it? I know when I was delivering this content to my students, we looked at a lot of the reports that are in place and a lot of the strategies that are in place, and it looks to be, you know, it's very idyllic in the sense that the professionals are looking at these issues and taking on these issues and creating these strategies, but are they actually achieving anything at the end of the day? And that was a task that I set for the students independently, was to actually go away and look at these strategies and see, have they been achieved? Or, you know, is it just to, yeah, this is an issue, we've got this issue here, let's patch it up with a strategy and actually not do anything else about it. You know, I suppose we need to really figure out what's going on.
I guess that's a really interesting point as well, isn't it, Stephanie? It's looking at what actual measures and deliverables are in place.
Yes.
To measure this by, because obviously I had a chat with some of the criminology team yesterday, and they were talking about knife crime, which was touched on in this as well, and the public health approach to that. And one of the things that they kind of raised there is that, you know, it's this full holistic approach to these kinds of things, but then how do you actually tangibly measure the reduction, or you know, especially when it comes to education, how do you measure the impact of that?
Yeah, just to interrupt you, not to interrupt you, but just to jump on what you've said there. I think it's all well and good oftentimes looking at things from a holistic point of view, and we all love the word holistic in health and social care, don't we, and in research. But I think we need to, you know, really think about, is it a holistic viewpoint that we always need to make? Because when we look at things as a whole, oftentimes I think things are really getting missed, like the smaller things that are pertinent to some areas rather than others, you know. So I think we try and look at the bigger picture all the time, whereas sometimes we need to potentially maybe focus on the actual smaller issues that are going on. I don't know if anyone agrees or disagrees with that, but
Maria, do you?
Yeah, I do.
Yeah,
I do agree.
Sorry.
Okay.
Yeah,
let Maria go, shall we, Alice?
Yeah, I do agree with what Stephanie just said.
Sorry.
Maria, go on, Maria.
Oh, I totally agree with what everyone's been saying, actually. I think it's very, very important to focus on the local community. That is so important. And better investment in public services as well. Giving local community more control in their own spending. That's very important, I think, which target on public health issues which matter to them, which is smoking, mental health, obesity. So that's the main thing. I think that's very, very important.
Yeah, we just touch on devolution, don't we? We don't actually really address devolution. We understand it as a term, but you know, there's actually, I don't think much, if any, power given back to, like you say, local authorities and local communities and strength-based approaches. I think it's very much this is a fancy title we'll put on this, and this is something that we'll say we do, but do we actually get around to?
Or one size fits all, which is
all right. I think Stephanie, you mentioned about education is the basic and the first step in terms of addressing health inequalities. It's assumed that once we have the basic education, we'll be able to look after our own health. That's number one. Apart from that, we'll be able to secure jobs that will be able to let us live a good life, balanced diet that will keep us more healthy and extend their lives. And apart from that, I think the health section comes in what the government is doing now is abolishing all the primary care trusts, which have been abolished, and then replaced with clinical commissioning groups, so that providers will be able to, GPs will be able to look at the health needs in the community so that they can address it. So they take their budget into their own hands. So that if it's Hardwick in Manchester that we felt that knife crime is an issue, or smoking is an issue, or drinking alcohol is an issue, then more resources will be focused there. So that is the commissioning aspect. And that is a government effort to abolish the primary care trust and then put in the clinical commissioning groups, CCJs, so that local issues will be addressed. And these are some of the practical ways that the government is using to address the issue of health inequality from the health perspective. But of course, it starts from education, where people will be empowered, they'll be able to take things, matters into their own lives. But apart from that, in terms of correcting the already difficult health issues, CCJs has been established. So their role is to make sure that they can deal with local issues. So that, for instance, if smoking is something which is a public health problem, then the GPs have the right to spend more of their money on prevention or education on smoking instead of the previous primary care trust where they come up with what needs to be spent on what. So this, in actual fact, is working in deprived areas where services that are needed for them are targeted.
Is that kind of the practical application of devolution, really, isn't it?
Yeah,
giving individuals power rather than the, like Maria said, the one size fits all, isn't it?
Yeah,
I think that's key. The local community, definitely.
Yeah.
There was a gap. I know I might be slightly going off topic here, but I suppose then you've got I understand the CCGs are quite effective and they work quite well, but you've got your highly affluent areas, where we do see obviously health inequalities, but maybe not as large as what you would see in the most deprived areas. But I think that the areas in between that get a little bit forgotten about. The areas that aren't really very, very deprived and aren't really up there with being classed as affluent or wealthy either. We've got those areas. For example, I live in Caddy's Head, which is beside Earlham, outside of Warrington, kind of between Warrington and Trafford, and we're forgotten about. Our local community is absolutely forgotten about because A, we're not deprived, and B, we're not affluent. So we don't have a Startwell centre. We don't have a lot of community resources or facilities because we're not poor enough to be flagged up and we're not affluent enough to be flagged up either way. So quite frustrating for those areas that are kind of being missed.
Yeah, that's an interesting point there. That's an interesting point, yeah.
I mean, my view personally on health inequalities, and I'm going to be quite. I'm gonna pin my sort of allegiances firmly on the banner there. But I think my view is the whole issue with health inequalities is, what I think was being said by the Marmot review 10 years on was basically that in the 10 years since 2010, when Michael Marmot identified that we have this thing called the social gradient of health, which was already been identified in 1980 in the Black Report, and obviously since that 1980 Black Report there's been a lot of government initiatives introduced to try and close that gap and try and get rid of health inequalities. And then, what the data is consistently showing us is that life expectancy, which has been on average across the population, been going up year on year exponentially, probably for the last 5-6 decades, all of a sudden it's starting to stall. And what's of real concern is that in the poorest parts of Britain, particularly some parts of northern England, within certain communities, life expectancy is actually starting to fall for the first time, and that is unprecedented because it's been noted that during the time where the global economy has been sort of reeling from the impacts of recession and austerity measures that have been introduced in response to that, some of the other Western European countries who haven't perhaps made such strident cutbacks to public services and public spending, it's been noted that life expectancy in those countries has still continued to go up in spite of some, scaling back of government spending on either welfare benefits or on public services. I think the difference with the UK is that when you actually look at some of the data and some of the data on austerity, I think something like in 10 years. The Local Government Association have reported that there's been something like 50% cutbacks on local authorities' budgets. And if you think of the fact that local authorities, were responsible for dealing with all the key determinants of health within their locality, that is going to have a very, very profound effect. In addition to the fact that we're seeing cutbacks to vital services and things that might offer safety nets, things like Sure Start centres, for example, We've also got the double whammy of the fact that there's been massive reforms to the welfare system, like things like the bedroom tax and universal credits and things like that. And again, the overall impact of these things is that we've seen an exponential rise in the number of people falling into absolute poverty, you know, and we can see that with the rise in you know, usage of resources such as food banks and things like that. And you have to think about the fact that, you know, when we think we're one of the top 5 richest economies in the world, the fact that we've got so many people reliant on food banks is a massive concern. So for me, it requires action, and I think Michael Marmot has basically said as much within his analysis, as have the Institute for Health and Equity within their report from 2010. Is what we need action across society to address, you know, ultimately the thing that are the wider determinants of health, which, you know, ultimately comes down to people's income. It comes down to the standard of housing that people have. It comes down to people's educational opportunities. It comes down to services and support and things that are available for people. So ultimately, you know, it's rather like I'm getting on to another rather controversial subject, that of COVID-19 and the government's handling of it. You know, my view is that you know, the reason that we are seeing health inequalities actually get worse for the first time in decades is a direct consequence of government austerity policies. Some people, some politicians and commentators have been, you know, brave enough to actually, you know, stand up and be counted and say that that is the case. In fact, I think if you look at what was said on that video clip, I think all the people on there, you know, pretty much said as much, that a lot of the issues underpinning health inequalities are down directly to government policy, and that has a big knock-on effect on the population. You know, if you think about children and young people, all the research into issues around child protection, the vast majority of children in Britain today who are on child protection plans come from, you know, lower socio-economic groups where, you know, poverty, you know, often coexists with other problems as well. So for me, the key to addressing health inequalities is, you know, it's about wholesale structural changes in society. You know, it's possibly about things like introducing a progressive taxation system, making sure that, you know, everybody in society has the same guaranteed universal basic income, which happens in some countries, and by doing so, I think what we're going to do is reduce that wealth gap, because health inequalities ultimately arise from wider social inequalities. So as the gap between the rich and poor in society has grown bigger, so have health inequalities as well. And it's interesting to note that the government's very own definition of health inequalities is unfair or avoidable differences in the health status of individuals or groups in society. Those two words, unfair and unavoidable, to me, you know, they stand, you know, they shout at, you know, governments and policymakers who are, you know, committed to delivering the best possible outcomes for, you know, the population of this beleaguered nation. Then I'm afraid to say that, you know, health inequalities will still exist. And, you know, it's been very, very clear and very, very evident that, you know, the decade of austerity, you know, has had, you know, quite frankly, a devastated impact on, you know, not only the health and social care sector, but also society at large. And I think, you know, I think I've made it very clear in terms of what I think needs to be done in terms of trying to address the the situation. So anyway, I'll let somebody else get a word in edgeways.
I'm sure there's a seat in Parliament for you, Adam.
I'm sure there is. I'm sure there is.
I think it's
also for me, for the near future, within 5 to 10 years, the gap between the rich and poor is going to widen. Taking into consideration the impact of COVID,
a
lot of jobs gone now. The government is not able to sustain the furlough system. At the moment, if you go to city center, all the high street jobs are gone. People are losing their jobs here and there. So it's going to actually exacerbate the already dire situation, especially in the north.
I agree with you, Elvis. I agree with you.
And then some pragmatic policies also have been shelved, such like the HS2 rail to link the north and south to bridge the gap. All those issues have been shelved at the moment. So it's like policies and implementation are quite different things. So if it's not addressed holistically, we're going to, for the next 5, 10 years, the gap is going to worsen. That is my own assessment.
Yes, I think you're right. I think you're absolutely right. I think it's wholesale action across all sectors of society, really, because, you know, if anything, the impact of COVID lockdown is only going to make the economic conditions worse for, you know, a substantial number of people. You know, the ones whose, you know, furlough payments are going to come to an end, the people who are working in the you know, in some of the you know, the entertainment industry, for example, you know, who have been left without an income for a very long period of time. Obviously, that has a knock-on effect on the rest of the economy because those people can't then spend money on consumables and so on and so forth. So,
and the NHS are going to be the first to face the brunt of the cuts, aren't they, when they need to come around?
Yeah, that's absolutely correct. And then if you look at the, you know, the analysis by, you know, watchdogs like the King's Fund, I mean, although the government are very keen to say year on year how they're investing more and more money in the NHS, in reality, it represents, in real terms, a cutback because, you know, demand on the NHS is increasing all the time because of the increased costs of technology and treatment, and the fact that we've got an aging population living with, you know, very large numbers of people living with what we call comorbidities. So demand on the NHS has been, and social care system has been increasing over time, and yet the funding has not, in reality, kept pace with that. Now, obviously, at the moment, we're going through sort of the COVID crisis, and, you know, there's been a lot of short-term investment in hospitals to keep the system sustainable. But we keep being told by politicians that, you know, in the longer term, we are going to have to pay the price for this through, you know, either higher taxation or, you know, potentially reduced services. And generally, what we tend to find is that people who are most reliant on things like health and social care services and benefits, and, you know, the voluntary community groups that very often act as a really useful safety net. The people who tend to lose out tend to be the poorest and the most disadvantaged people. So, you know, do
you think this will have a knock-on effect? I suppose we're sidetracking to COVID, but it is in relation to health inequality. Do you think this will have a knock-on effect on the appeal of people taking on jobs like, you know, in healthcare workers, nurses, doctors, things like that? Do you think it will have a knock-on effect, especially if, you know, we see all the nurses and frontline workers, health and social care workers, everything they've been through, and they've still not got a pay rise yet? I know. I think if I was starting my vocation again, and this was the way, I think I'd be second guessing it, to tell you the truth. So I'm just wondering if you think anyone else might have that opinion as well.
Well, I mean, I think there has been some labour market intelligence which has suggested that, you know, I think that it's a bit of a double-edged sword, really. I think on one hand, I think it's increased the profile of, you know, nursing and healthcare and so on and so forth. And, you know, there has been some suggestion that there's intelligence to say that, you know, that it's actually increased demand for you know, people who wanting to go into that profession. But on the other side of it, you can also see the flip side of it. You know, when you hear these, you know, horrific stories about people who are having to work sort of 8-hour shifts in you know, in very hot, sticky conditions where they're sort of enveloped in PPE to prevent infections being spread, where they're having to, you know, daily watch people pass away, you know, with the due to complications linked to COVID, and you know, it's having massive impact on those people's mental health.
Which again comes around full circle, doesn't it, as well, because that then showcases the lack of level of mental health support and funding, etc., doesn't it? Because
it does, yeah, it does, yeah.
Yeah,
but,
I've got to say that,
you know, it's a very challenging set of circumstances for people working in the sector at the moment. And I think, you know, the whole thing about COVID is that it's, you know, when we're talking about the issues around health inequalities, it's also, you know, brought health inequalities into the spotlight even more, because it's been shown very, very clearly that people from low socioeconomic backgrounds are at greater risk of contracting COVID and at greater risk of suffering complications. Likewise, we've also seen that, you know, with the BAME communities, again, there's been clear health inequalities evidenced through COVID in terms of, again, the prevalence and in terms of the you know, the mortality rates. And again, there's a lot of different reasons for that. It can be quite complex, but a lot of it is down to, you know, the sort of possibly the industries that people are working in, where they're very much public facing, like transport, like the NHS, like social care. It might be because other issues like deprivation and multi-generational households. I know at the moment there's a lot of appears to be a big push from the government around, you know, raising awareness around the need for vaccinations within certain communities, because again, there appears to be some misinformation being spread. So there's lots and lots of very complex factors that we have to take into account when looking at these issues. And yeah, I mean, I go back to my original point. Health inequalities stem from wider social inequalities, and you know, until we, you know, meaningfully attack those and address those, then, you know, for me, health inequalities are always going to be with us.
Just a question then, I guess, is, so UK is considered a first world country.
Yeah.
At what point, when we have issues like this, where we've got the World Health Organization intervening when it comes to kids who are in poverty and not eating,
that's right,
do we actually drop down? I know there's quite clear measures of that kind of thing, but I guess it's that kind of consideration of the UK as a society. Are we still a first world country, really, in the context of this, at least?
Well, absolutely, yeah. I mean, I think you know, it depends on, you know, I think the measures of economic success, you know, in terms of GDP, for example, you know, that's what essentially ranks us in the top 5 or the top 10 of the richest nations. However, if you then use other measures in terms of, you know, life expectancy, and it was known even before this this crisis that as a country, we perform worse than a lot of the other European countries in relation to, you know, cancer survival death rates and heart disease survival death rates and so on and so forth. That, yeah, it could be argued that, you know, if we are going to be looking at other measures of health and well-being in society, you know, it might be suggested, it might be more appropriate to rank us rather lower. And again, I think that it's very interesting that one of the video clips of Michael Marmot that I watched a couple of months ago, that I always show to the students when he's talking about the impacts of health inequalities, he said what was really interesting was that he did quite a lot of research in America, and again into health inequalities, and again he was talking about in the areas where people were actually you know, most likely to suffer premature death, you know, often the very poorest parts of America. And he said the big irony was they were the people who were most likely to vote for Donald Trump, who, as we all know, has been fairly vociferous and outspoken in his condemnation of some of the, some of his opponents for wearing masks and such the like, and some of his rather almost comical comments about sort of people using disinfectant to basically protect themselves from getting COVID. It's quite laughable, really, that here was a man who was the most powerful leader of the Western world, who was espousing such views that were quite clearly causing massive embarrassment to his public health advisors. And again, I think if you look at this country, what's very significant politically at the moment, it's saying that the government, the Tory government, are are still probably ahead in the polls politically. And again, I know this has caused a certain amount of consternation amongst some of the political opponents on the left, who are very quick to point out that the government's performance on COVID, for example, has been, when you think we've got essentially one of the worst death rates in the world, and the government's performance on COVID has, you could argue, has been a litany of errors. For example, going back to 2016, there was a thing called a dress rehearsal called Operation Cygnus, where they looked at how well the country was prepared for a pandemic, and it concluded that we weren't ready, we weren't prepared for it. And what we needed to do was stockpile personal protective equipment, as an example of one measure. That, of course, subsequently did not happen. In January 2020, Matt Hancock, our health secretary, who was talking about the fact the impending transfer of COVID to our shores after what had happened in Italy and Spain, was actually saying that we were really well prepared for it. In reality, we clearly weren't, because the government delayed the lockdown. If you recall, the Cheltenham Festival went ahead, and there was international football games as well with an Italian, I recall, and mass gatherings were still allowed. There was a delay in the lockdown, and also, it was clear that the PPE that was required wasn't stockpiled. Hence, a lot of people who working in the healthcare industry ended up contracting COVID because of lack of adequate personal protective equipment. We also had this bizarre situation where older people in hospital were basically allowed to return to the care homes while they were COVID positive, which resulted in something like an estimated 30,000 deaths. That's been estimated in terms of the care home mortality rate. There's been other things as well that the government have been clearly, critical of. Obviously, there was the whole Dominic Cummings debacle, which I'm sure everyone's aware of, where the government failed to take robust action against the guy who was their senior advisor, despite his indiscretions, which were in complete breach of their very own guidelines.
Sorry, Adam, can I just jump in with what you're saying there? I completely agree with what you're saying, but do you agree as well that a lot of this is fantastic in hindsight too? Is there any way that we could have had the foresight of the knock-on detrimental impact and effect that COVID was going to have on all aspects of our life? Because I think, irrespective of your personal opinions on.
Yeah, what I would say to you, you might say in hindsight it's all very well, but my question is, if you look at the way, if you take a country like Korea or New Zealand, for example.
Don't disagree with you, by the way.
What they did was, they didn't mess around. There were, there was clear leadership. They had a clear policy. They locked down quickly, and because of that, they prevented the spread. Obviously, you could argue it's easier with a smaller country, and but as somebody pointed out, we are an island here. We didn't close our borders until, well, even now they're still open. I mean, they're talking about bringing in more robust quarantining, but it's taken them until now to do that. So the question is the differentials. You know, if we're looking at differentials in health inequalities, the differentials in things like COVID rates, which is, you know, maybe a slightly different thing, is, you know, again, ultimately down to leadership from my perspective. You know, if other countries have, you know, performed, who've got similar populations to ours, who've got, you know, a death rate, which is a mortality rate, which is a fraction of ours, that for me speaks volumes. And we've seen lots and lots of things that have been done. You know, if you think that first test and trace,
let's not.
Yeah, let's not.
Let's not give it any more thought.
It was absolutely farcical, quite honestly. You know, and if you think about what's happened in education after Christmas, you know, while they were umming and ahhing, you know, if you think over Christmas, the government said, oh yeah, you can go and meet with your families over Christmas. It's almost as if, you know, COVID is going to take a holiday over the Christmas period, and clearly that's not the case. There's no evidence to show that. And then what they did was there was this ridiculous thing whereby the children were allowed to go back to school for one day and mix, okay, and then the day after they decided to change their mind. And I remember watching Boris Johnson on Andrew Marr in the morning, the Sunday before that Monday when the kids went back to school, saying how safe schools were. And of course, you know, what the evidence from the public health specialist shows is that clearly that's not the case, and that, you know, that schools are and children mixing it is a clear vector for spreading disease, which ultimately has proved to be the case. And if anything,
not just the children, is it? You've got all them adults who are congregating at the playground, and you know, you've got teachers who might not be adherent to it, and it's right. Yeah, it's not just
and I'm the first to agree. I think there's been, you know, a lot of people say, well, you blame the government, but there's a lot of people out there who have clearly chosen to flout the rules, haven't they? And they've clearly not, you know, I've been out in supermarkets and stuff, and people have walked past me about, you know, a couple of inches away from me, you know, and I think, well, you know, social distancing is, I think there are certainly issues where individuals have chosen quite clearly to ignore the guidance that's been given, and, you know, obviously that's not helped. But for
on
me,
that note, I can say that it's all boiled down to unpreparedness of the UK and not having facilities in place. Because if you look at poorer countries, a lot of them in Africa, you could see that because of constant epidemics like Ebola and all those, they were having all those facilities in place already. They were prepared. So people begin to wonder why countries like Gambia, Ghana, and the rest, people are not dying in their numbers. Because they are constantly experiencing epidemics of different forms. So the facilities and all those were already in place. So they knew how to look at it. So I believe Britain and the US, so that I can say, were caught unprepared. And we cannot put the blame on poor Boris. I think my old man Boris did the best he could.
Yes.
Unpreparedness.
You think Boris did the best he could, Elvis? So you think Boris letting all the kids go back to school in January was the right decision?
That was clearly the best of Boris's abilities,
I would beg to
Adam.
differ on that one.
That was clearly the best of his abilities.
You think the decision to delay the lockdown not once but twice wasn't Boris's fault?
Well,
again, I would beg to differ, sir. I would beg to differ.
Can I just come in there?
Boris will have done better, but UK as a whole was not having the infrastructure in place to deal with it, so it just caught everybody unprepared. That's what I can say.
Can I just come in there on that then? Does this go back to what we're saying about this inequality issue to begin with? Is essentially too much power sits with a very small group of individuals right at the top who have a very specific view of life, because they've been, you know, we see it, you know, most MPs come from a very privileged background, don't they? Like, their experience of life is vastly different. Whereas what we're really then talking about is, again, devolving that power so individual areas can have the support they need and deem what's appropriate based on their knowledge of their own community.
This inequality thing must start from the top. If you look at the whole world, 2% of the global population are having 80% of the global wealth.
That's right.
So that's how bad it is.
Yeah.
And this translates into every country.
Yeah.
And a few of the elites are having the bulk of the resources. So you could see that politically, economically, socially, you could see the trend. So unless inequality is addressed holistically to bridge the gap between the rich and poor, I've lived in Norway for 4 years before coming to England. You could see that there is no gap at all between the rich and the poor, right? So you could see that life expectancy is very high in Norway compared to Britain. So more or less, Britain is more or less little on the past glory. Other countries are doing very, very well because they've been able to bridge the gap between the rich and the poor. Yeah. And that is something that we have to look holistically in England, right. In UK as a whole.
I lived in Holland. I lived in Holland for 2 years, and again, the gap between the rich and the poor is not nearly as great, and the welfare benefit system is a lot more generous than it is in this country. So again, the gap between the rich and the poor is not as severe as it is in this country.
Maria, do you want to come in there?
I concur totally. It's very, very complicated. Like Adam said, it's structural. It could be philosophical, political, economical. It's very frustrating. Is there an answer?
Well, Karl Marx said we should have.
Can we leave it on that? Is there an answer?
Yeah, well, I think that's it, isn't it? It's looking at what we as individuals have within our remit, and we as individuals can change.
I think we should tackle the inequality issue from political, economic, and social perspective. At the same time, see, more often we concentrate on the social bit, but if we should concentrate on all the aspects, politically, socially, and economically, if we use these three tools together, we should be able to break the gap and then lower the level of inequality within UK.
Yeah, that's brilliant. Shall we leave it there? I think, like I say, we could talk on this for hours. It's not. It's not a quick solve. Otherwise, it might have been done, mightn't it? But yeah, thank you all.
Adam's views now as well. We know Adam's views.
Thank you all very much.
I'm
very clear.
I'm not really a Marxist revolutionary, honestly.
No, of course you're not. No, I never thought that.
I believe we need reforms. So we need reforms.
Brilliant. Well, thanks very much for joining us, everyone. We hope you've enjoyed this as much as we have. I think, like I said, a lot of food for thought, very interesting. And if you are joining us in the coming years as a student, it'll be interesting to continue to discuss and look at how you as individuals in your new professional roles as well can help shape change and make the UK a more equal place to live for us all. So thank you, Adam. Thank you, Maria. Thank you, Albus. Thank you, Rebecca. And thank you, Stephanie. It's been fabulous to have you all along. Thank you. Bye.
Thank you.
Bye. Bye. Bye.